Good morning, Miss Dela Cruz. I'm Jeannie. I'll be your nurse for today. How are you feeling?
I feel amazing. I can't believe I'm a mother. Oh my God.
Congratulations on your newborn.
Thank you so much.
You're almost ready for discharge soon, but before we're able to discharge you, we will need to give you patient nutrition. Will that be okay?
Yes. Please give me as much info as you can. I want to be able to take care of my child at home.
First, I will start off with explaining the umbilical cord care. We will need to keep the umbilical cord clean and dry. The cord stump can be removed when dry after 24 hours and cleaned with water. Watch out for swelling, redness at the base, drainage, or a foul odor from the trunk at each diaper change. When changing the diaper, remember to hold the upper edge down below the umbilicus to keep the stump dry.
Okay, I'll need to keep the umbilical cord clean and dry. Remove the cord stump after 24 hours when dry. Clean stump with water after it dries. Watch out for swelling, redness, drainage, and foul odor. And make sure to fold the upper edge of the diaper. Sounds good. So, I'm nervous about bathing my son. Do you have any tips?
So when bathing, you would want to start out with a simple sponge bath and continue with it until the umbilicus cord stump falls out. Then you will able to transition to tub baths.
Do I give him a bath every day?
Daily bathing is unnecessary. In fact, it disrupts skin integrity.
Oh, so when's the best time to give my baby a bath?
A good time for a bath is when the newborn is awake or before feeding. Never leave the infant alone during bathing, not even for a second or two. The recommended temperature would be 36.6 Celsius to 37.2 Celsius. You will also need to use a soft, clean washcloth, not any cotton balls or swabs.
What do I start with first?
Begin by washing the face with plain water. Cleanse the eyes from the inner to the outer canthus using separate parts of the washcloth for each eye. Wrap the infant in a blanket when washing the hair and scalp. Use one hand or a soft brush to wash the scalp with water and a mild unscented pH neutral soap. This and regular hair brushing prevents scalp peeling or cradle cap. Wash the creases in the neck, under the arm, legs, and in the groin as well as the rest of the body with soap and water. Use corners of the washcloth to clean the ears and nose. Be sure to wash between the fingers and toes. Dry the newborn thoroughly to prevent heat loss.
It sounds doable. So my friend's baby has diaper rashes. Do you know why it happens, and how do I treat diaper rashes from happening?
So diaper rashes can happen to a newborn. It's usually caused by a bacteria that causes diaper dermatitis, which thrives in moist, dark areas. To prevent diaper rashes, clean the area after each urination or bowel movement. Expose the buttocks to air helps prevent bacterial growth. For infants prone to diaper rashes, or to help heal a diaper rash, you want to apply zinc oxide ointment to protect the skin.
Okay, I remember to clean the area after urination. I'll remember to clean the area after urination and bowel movements and let it air dry. I'm concerned about his nails. When's the best time to trim his nails?
So for nail care, the best time to trim the nails is while the infant is sleeping. It's not necessary to trim a newborn's nails until it grows long enough to extend beyond the skin of the tip of the fingers and toes. You can use manicure scissors or clippers to trim them and file it down with a emery board.
Okay, so when I dress the baby, do I dress him in more layers to keep him warm?
So when dressing your baby, you should dress the newborn as warmly as you would dress yourself. A cap can help minimize heat loss and protect the infant from the sun. Swaddling in a blanket provides a secure feeling and helps maintain body temperature. Avoid overdressing the newborn.
Okay, good to know. So I have questions about safety. What else can I do to provide safety for my child?
So in order to promote safety, I will give you a couple instructions. So I have a couple instructions that I would recommend preventing from doing. So do not leave an infant alone on a bed, temperature, table, or furniture. Test bath water temperatures with a bath thermometer before giving your baby a bath. Pick an infant up gently and never swing, throw, or shake the baby. To prevent suffocation, do not place pillows, stuffed animals, or loose beddings in the crib of an infant. Position the infant supine to reduce the risk of sudden infant death syndrome. Never leave an infant in a parked car alone. Also, I would also recommend to use a federally approved rear-facing car seat and secure it in a rear seat of the vehicle. So I do have a flyer with more safety instructions for you to take home as well.
Oh, thanks for the flyer. That's really helpful. So, another question, when should I contact my provider?
Please contact your provider if significantly high or low axillary temperatures, frequent vomiting, poor feeding, diarrhea, decreased urination or bowel movements, cyanosis, breathing difficulty, lethargy, inconsolable crying, eye drainage, or bleeding from the umbilical cord or circumcision site.
Okay, so I should contact the provider if my baby has any of those symptoms.
Yes, please contact your provider. Do you have any other questions?
No questions, thank you. It does seem like a lot of info to remember.
Yes, but I do have some handouts for you to help you remember all of this.
Oh, thank God. Thank you so much.
No problem. Now you're ready to get discharged. Congratulations on your baby, and I wish you all the best.
Yay!